Hi everyone, I'm back. A little premature because I realized that I had not discussed one topic, and that was the one with the cervical collar. So I thought I would make it up to you by just doing a very short video and adding a few other topics. Okay, in this video, the topics for discussion are: what is a cervical collar? Why is a cervical collar put in place? What can we learn about chest pain? And lastly, what is an ileus? So let's get started. This is still session 70, but just quiz 3, I'm so sorry, just a little bit extra. Okay, the question was, why is a cervical collar put in place? The patient was transported to the emergency room after an accident. A cervical collar is put in place following trauma. It is done to immobilize the spinal column in case of any fractures which might cause damage to the spinal cord. Typically what happens, an X-ray is done to be certain that there is no damage to the spine, and then there is no damage to the spinal cord column, and then the doctor usually gives orders to have it removed. Otherwise it stays on as long as it cannot be verified that there is no fracture, because if you have injury to the spinal column, and you move that patient the wrong way, maneuvering back and forth without taking into account that the spinal cord is involved, you can do horrific damage. It may be permanent. So let's move on to the next topic now, which is chest pain. Chest pain is not as uncommon as we think, and it's not always cardiac. Sometimes it is, sometimes it's not. Most of the time it is cardiac related, but it can also be brought on by stress. And the question is, what can we learn about chest pain? If a patient is having chest pain, it is advisable to act fast. And the reason for this is, until you can verify that this is not cardiac pain, it's best to do something, to do an assessment, to make sure that you have everything under control. And some of the considerations are, you can ask questions like, to ask that patient to identify on the scale of 1 to 10, how bad is the pain. And then you can also, some of the things that happen with chest pain are, the pain may feel like pressure in the chest. It may even feel like someone is squeezing that person, just squeezing tightly into the chest. It may feel like a stabbing pain, and sometimes it even feels like a weight on the chest, or you may even have it like you have radiation to the jaw and to the back, depending on what the mechanism of injury is. If you are having a heart attack, what kind of a heart attack it is. I'm not going to get into all these details now. If you want to learn more about chest pain and more about things like the cervical collar, of which I just spoke, you can look at some of my other videos and refer to them, especially the EKG ones. It will give you more insight into chest pain. And lastly, I wanted to discuss what is an ileus. What is an ileus? Well, an ileus is just may develop in postoperative patients following abdominal surgery. And the problem is with an ileus, even after patients have had surgery too, even the anesthesia can cause it. The stuff that they use, those drugs that they use for anesthesia can cause that problem. And what happens is they get abdominal pain, absent bowel sounds, and a lot of abdominal distension too, and discomfort. Typically what happens after patients have had surgery, you listen for bowel sounds, and the next day or two, it's very important that you do and hear bowel sounds, and you do an abdominal assessment to make sure that they don't have a lot of distension, and you can actually hear the sounds if they're there. If they're absent, it's not a good sign. have a video on bowel obstruction, and that might be of interest to you if you want to know more. So this is rather a short video, and again I apologize for missing that cervical collar, and I've just given you that other site called dearnurses.blogspot.com, which might be of interest to you if you would like to know more about different topics. And there's also patreon.com/dearnurses. Have a great day.